Good afternoon, and thank you for joining us here on 9 News Watch for a special version as we're going to focus on COVID-19 vaccination, specifically in the Hispanic community here in Colorado. And to help us get some not only expertise on this subject, which we'll get into more details to why we're doing this here in just a second, we're going to have a bilingual conversation with Dr. Ricardo Gonzalez Fisher from Servicios de la Raza and Stephanie Rodriguez, a reporter from Telemundo Denver. Ricardo, Stephanie, thank you so much for being with us here for this, again, very important conversation on this, what's going to be Snowy Tuesday.
Thank you.
Thank you for having us here. Thank you very much.
Yes, this is a very important topic. And one of the key reasons we're having this conversation, again, this will be bilingual. Vamos a hacer esto en español también. So if you are joining us in Spanish, again, we will have this conversation with Stephanie specifically in Spanish in about 5-6 minutes time. So the same questions I will be asking in English, Stephanie will ask in Spanish in a few moments. So again, one of the key reasons we're having this important dialogue right now is that only about 38.5% of Hispanic Coloradans are vaccinated against COVID-19. That is significantly lower than other demographic groups or other here in the state of Colorado. So it is an important topic of conversation. And of course, that is something we're trying to boost here today. And so hopefully we can answer some of your questions, and having Ricardo's expertise will certainly be helpful here this afternoon. So Ricardo, I want to start things off by asking you about that 38.5% figure amongst Hispanic Coloradans who are vaccinated against COVID-19. I guess a two-part question for you to start things off. One, why do you think that number is so low? And number two, have we seen any inroads? Have we seen any increases in that number in recent weeks?
Well, thank you, Chris, for asking that question. And I think that everybody who's listening to this should pay attention to those numbers. I have the privilege to be serving the Mexican immigrant community in Colorado through the Ventanilla de Salud program that Servicios de la Raza runs at the Mexican consulate. And we've been talking to people for years now about this. About 42% of the people that we serve are uninsured. And this is one of the things that has certain impact on them. The other part is that a lot of the people that we serve are monolingual Spanish speakers. They don't understand the system. They're front line workers that don't have permission from their employers to go to get a vaccine sometimes. And there's a lot of distrust in the system. All of those things combined make a stew that makes it very difficult for people to move around and get the vaccine. Some of the things that I can say is that mandates work. When we started to have mandates, we started to have an increase on people getting the vaccine. And with the when we start to see Omicron, the Omicron variant, we also start to see a rise in the number of people who are coming to get the vaccine for the first time. It's very interesting. On the clinics that we've been doing in January, I think that around 30% of the people we vaccinated were first doses.
Well, that's an encouraging number, Ricardo, and we're going to get more into this here in just a few moments. But one of the top line takeaways is that Servicios de la Raza will be hosting a vaccine clinic after work every Tuesday. Now that, because of the snow tonight, is being pushed back to Thursday of this week. But again, there's going to be a weekly vaccination drive, weekly clinic. And Ricardo, frankly, that's kind of encouraging to hear that we're starting to see some of those numbers increasing in recent weeks amongst the Hispanic community. And again, that's the thing we're trying to solve here. Now,